Welcome to nerdsbazaar.com. Our topic is myocardial infarction or MI. Definition: myocardial infarction is a process by which areas of myocardial cells in the heart are permanently destroyed. So when you get a myocardial infarction, the myocardial cells in your heart are permanently destroyed. Causes: it may cause because of a reduced blood flow in a coronary artery. This reduced blood flow may be due to atherosclerosis or occlusion of an artery by an embolus or thrombus. The second reason is vasospasm. Vasospasm means sudden constriction or narrowing of a coronary artery. Third, decreased oxygen supply may be due to acute blood loss, anemia, or low blood pressure. Fourth one is increased demand for oxygen, example from a rapid heart rate or thyrotoxicosis or ingestion of cocaine. Area of infarction: different area of your heart may get infarction. Mainly we can see left ventricular wall. In left ventricular you can see the anterior wall, inferior wall, posterior wall or lateral wall. So any of these wall may get infarction. So in left ventricle wall you can see anterior MI, inferior MI, posterior wall MI and lateral wall MI. Also right ventricle affected by this infarction. Clinical features: main clinical feature is chest pain or chest discomfort, palpitation, then increased jugular venous distension, hypertension or hypotension. Hypertension or hypotension may be it depends upon the sympathetic stimulation. So sometime hypertension, sometime hypotension. Tachycardia or bradycardia, dysarrhythmia, shortness of breath, dyspnea, pulmonary congestion, pulmonary edema, nausea and vomiting, then cool and clammy, diaphoretic and pale appearance skin. This cool and clammy skin is an indication that the patient is going for cardiogenic shock. Then dependent edema, headache, visual disturbance, altered speech, altered motor function, etc. Assessment: when you do an assessment, first one you can do a 12-lead ECG. In ECG you can see sometime ST elevation, sometime ST depression and T wave inversion. If there is ST elevation, that type of MI is called as STEMI. ST elevation MI, that is the short full form of STEMI. ST elevation MI, STEMI. So normally this is your ECG, this is your normal ECG. But when you have MI, when you check the ECG you can see ST elevation. See PQRST, ST, see the ST elevation here, ST elevation. So this is a STEMI. And in some case you can see if it's a chronic myocardial infarction, you can see T wave inversion. So sometime ST elevation, sometime T wave inversion you can see, sometime ST elevation or T wave inversion. And in some cases you can see ST depression. There will not be any ST elevation, there will be ST depression. This is called NSTEMI, means non-ST elevation MI, that is NSTEMI. And in this also you can see T wave inversion. So basic changes: ST elevation or ST depression or T wave inversion. Look for all these three changes, then you can diagnose a MI. Then in different leads you can see the ST segment elevation. Depends upon the leads you can identify the location. If you see ST segment elevation in V1 to V4 leads, you know different leads are there. So the leads means every leads watch or take the photo of heart from different angle. So V1 V4 gives a different picture or angle of heart, and AVL AVF all leads are giving different picture. It means different leads means that they see heart from different angle. So if you see ST elevation in V1 V4, you can expect anterior wall MI. If the lead ST segment elevation is in lead 1 AVL V5 V6, that is lateral wall MI. If you see lead 1 AVL V1 to V6, that is anterior lateral MI. If the ST elevation is V1 V3 anterior septal MI. If the lead elevation is in 2-3 AVF, it is inferior wall MI. then 1 AVL, V5, V6, 2, 3 AVF. If the ST elevation is in these leads, it is inferolateral MI. This is not that much important for you, but for your information. So different leads will help you to identify in which area the MI is present. Laboratory test, you can do creatine kinase CKMB, creatine kinase heart muscle. Okay, creatine kinase, and it's a different isoenzymes are there. CKMB is the main isoenzyme we use. We will check for the CKMB in your blood. If it is present, it is an indicative of MI. Then myoglobin, you will check for troponin also. Among all these, troponin is the best one and more frequently used, and this is the first one we will check to identify a immediate MI. Management, first one you have to give 12 lead ECG, then thrombolytics. Thrombolytics, what it will do, it will lyse the thrombus, example streptokinase. Then nitroglycerin, it is a vasodilator. After giving nitroglycerin, it will dilate your vessels, so there will be more blood flow. Oxygen is important. Then aspirin, then analgesics, example morphine, aspirin, oxygen, nitroglycerin. These are the main medicines. Then ACE inhibitors. Then the last method is percutaneous coronary intervention or CABG. So these are the management. Thank you for watching this video. Please subscribe our video. For online nursing coaching, you can WhatsApp me on 00971 522069 9493, or you can visit www.nursebazar.com.